I personally don't open my Gelco yet, but you can. You're going to see why I don't open my Gelco in just a minute, okay? All right, so I do a mental checklist. This is the most important. Pretty much anything else I can troubleshoot. But once I've started the IV and connected this, I'm kind of up a creek because I can't prime it then. Okay, so this is primed, my kit's open, I've got my Gelco, got my gloves. Okay, so I'm going to put your tourniquet back on and it's going to be tight. I put the tourniquet on before I clean because if you clean and then put the tourniquet on, you are all over the field. One of the things that we watch very carefully is you're crossing over your field, okay? Purpose of a tourniquet is to occlude venous flow, not arterial flow, so I take a pulse, okay? Now I'm going to put on my gloves. You could have put your gloves on and then done the tourniquet. That would have been fine too. It's just a little bit easier to get the tourniquet on without the gloves, okay? All right. This is ChloraPrep. It is a sterilizing agent. You clean for 30 seconds on a peripheral line and it dries for 30 seconds on a peripheral line. It is different for central lines, okay? Listen for it. Crack. It fills at the bottom. Do you see the fluid down there? Okay, so I am going to dabble some fluid and now I'm going to clean big. And I said for 30 seconds. Now, I clean big and all over, okay? You actually need more space below where you stick than you do above where you stick. Because remember, when you stick, you flatten it out. Okay, now the last seconds, I'm going to tighten up and clean where I'm going to stick. Because I don't want it to be 26, 27, 28, 29, okay? I don't want it to go out of the perimeter. Does that make sense to you?
Yes.
Okay. I'm going to put this down. Doesn't really matter where I put down. I just can't be over my sterile field. It needs to dry for 30 seconds. In that 30 seconds, I am going to open my Gelco, take off the cap, get my fingers right in the finger places, and we'll do a close-up of this in a minute, okay? And put my finger on that little tab and test it. Push forward and pull back. All right? That takes about 30 seconds. For me, that is more comfortable than standing there looking at his hand for 30 seconds. Okay? All righty. I'm going to hold his hand and anchor the vessel. If you don't anchor the vessel, it will roll. Okay? I'm getting ready to stick you now. Now I tend to brace mine. You're going to stick at about a 45, okay, depending on the vein. Going to stick. When you get flashed, do you see that? You see the flash? Drop your angle about half of the amount. Go a hair further and then thread it. Push forward with your finger. Pull back until it clicks. Listen for it. Click and pop. Okay? Everybody takes a deep breath. You hold this green. If you want to, you can put a gauze up underneath it to catch any blood that comes. Okay? Apply pressure above to occlude the vessel. I need for you to get this up and the cap off. If you take a knife out of the wound, what happens? It bleeds. Okay? So if I take this off before I'm ready to plug it up, I got blood shooting everywhere. So I get this up. I am not big on one-handing anything. Have y'all kind of picked up on that? Okay, so you loosened your cap, use your knuckles, whatever, let go of it. Whenever you're doing this number, you're very likely to touch that. If you touch it, is it still sterile? No. So now I am going to unscrew and screw. Okay, I took this out. and I let it a couple drops of blood, that's okay. I'm going to shift my hand now so that I can see. Okay, unclamp me, Renee. Unclamp one of them, it doesn't matter. I need to aspirate first. Do you see the blood return? And I am flushing. I am watching here and here. If it is leaking, it is going to happen here. If it is swelling, it is going to happen an inch away, correct? Okay, so I am watching that and it looks good. I have my gauze. Should I put blood under an op site? No. That would generate a warm, moist, bloody environment. We do not want you touching your insertion site. Okay? Have I been reaching across my fields? I have worked to the back or to the sides, okay? I need to get this on. Now, y'all say, can I let go of it? You know what, guys? Y'all need to learn how to use your hands, and I can't really teach you that. You just have to practice it. I tend not to let go of my stuff because I've had too many come out if I let go, okay? I usually at least keep my hands really nearby, stretch it, put it down. I want it up to the clear plastic, but not on it. I only stretched it enough to get a good fit, not to distort it, okay? That paper gave me something. If you pull the paper off, it wads up on itself and you can't get it unstuck. Now I'm going to walk this off. Y'all noticed I still have my gloves on? Yep, because I still have blood on the field, don't I? Yes, ma'am.
Yes, ma'am, you do.
Okay, that's my label. Now I tear my tape. At least 4 inches. Tear it in half, okay? First one, you're going to come up with the sticky side up, guys, okay? Sticky side up. You want to come up. Now, it is very important that your catheter stays at the angle that your vein is. You see what's happening here? Is that going to flow? So, I have to make sure it's going the same direction, okay? And crisscrossing it is called chevroning, okay? And the reason for that is to keep it heading that direction, so whenever there's tension. My second piece, I'm going to put right on top of that one and get it down well, okay? Alrighty. I need to clean up my field, get rid of my sharps and any blood, okay? Because if you have blood on your hands, do you really want to handle your pen? Okay? On your label, you are going to put your initials, the date, and the gauge. Green is 18. You learned the gauges. Blue is 22, pink is 20. Okay? If this got away from you or got bloody, please don't use it. You can do a piece of tape. When you label it, please label it to the side. Okay? After this, pretty much how you tape is up to you. Of course, I like for you to tape the way I do it, but it is up to you once this is done. I still think you have a lot of movement right there on the site, so I'm going to put a piece of tape across this hard plastic thing, and then most of my movement is here. Okay? Alrighty, now I want to make a few points. I want to show you a couple of things. If you are cleaning with this, ChloraPrep is ChloraPrep. It is a sterilizing agent. You clean for 30 seconds, whether it's a swab or this little thing or the big thing. We don't really like these little things, and you'll understand why in a minute, but if you cover the area good and let it dry for 30 seconds, it is a sterilizing agent, okay? When you're cleaning with this, you would crack it. Okay? Get it going good. Now, you know that whole inside out thing? That is correct. But the problem is, if you're going inside out, in 30 seconds, you will have covered this much territory, okay? So what we really want you to do is get that perimeter, get a nice big perimeter. And then come in and tighten up on where you're going to stick for the last 15, 20 seconds. Does that make sense to y'all? Okay?